events. For those who don't know, I guess you probably would know why would you be here otherwise, right? But I'm David Berger, a board-certified pediatrician in Tampa, Florida. Welcome to my YouTube channel, Dr. David MD. Hopefully by now, if you're watching this, you are subscribing to our channel. If not, please do so. But also, please share it with other people. We really want to get as many people as possible hooked up to they can get this information, because we know that good information is hard to come by, especially in the world of health and choice. So it would be great to share the love. Also, of course, we are members. We do have subscription to our Patreon. We always take our Patreon members' questions first. In our Patreon members, they also get access to private information in terms of certain protocols, similar to like my patients do, and also a little to send along. Just to thank my members for supporting us, because it's the funds that helps to kind of move this along. So thanks a lot for that. Now, Whitley is joining us off screen. She is my manager of our holistic release clinic, and also has been on the forefront of helping move forward the Dr. David MD brand. So thank you so much, Whitley, for being there. And she will be receiving the questions and passing it along to me as we go forward. We will start with patients from our patrons, but then we'll move on to anybody else who has questions. And of course, this is general information. I'm not going to be talking about specific patients with specific conditions and specific diagnoses. This should be considered for educational purposes only. Of course, if anybody has more detailed information that they want to share with me, want to get specifics in terms of any kind of treatment protocols or educational consultations for people outside of the state of Florida, please contact our office, and of course, we can set you up for an appointment. Okay, so now that is out of the way, and I'm supposed to see here, hold on a second, where is the chat box? Oh, here it is. Okay, we're doing this a little differently. Okay, so Whitley will be giving me the first question here. I'm hopeful. Okay. Oh, okay, there it is. I was looking at yours privately, Whitley. Still trying to figure this out. You'd figure after a year I would know what I was doing. Nah, I'm not that formal. Okay, so first question here. I saw the news in the news article in the Washington Post about your patient who was denied an abortion despite having a baby that would not survive more than a couple hours after delivery. If the pregnancy goes that far, how is she doing? Thanks for asking. When this came to my attention, it's a patient who I've been doing primary care for, who I was just doing an annual checkup for. And when she told me that she was pregnant, of course, my natural reaction was congratulations, until the next sentence that came out to tell me about the Potter syndrome that the baby has, that does not have developing kidneys, therefore does not make amniotic fluid. Therefore, not only does the baby not have the cushion inside mom in order to help the baby grow, and to also cushion how it's lying inside the uterus, which is causing tremendous amount of pain because there's not the cushion. But also, amniotic fluid is essential for lung development of the tissue itself, for the maturing of the tissue, to have that single layer oxygen exchange between the outside world of the air and the bloodstream right on the other side of the alveoli, the air sacs that exchange the air. And not only that, but when a person has Potter syndrome and no amniotic fluid, one of the things that happens with a fetus, a baby, as they're getting towards the end of the pregnancy, is that they start doing it's practice breathing, and literally the opening and the closing of the lungs and the chest movements in order to practice for breathing. And that's something that does not develop when there's no amniotic fluid either. So I know I've shared this with other people, but some of these, they don't even survive, and there's a miscarriage late. Other times they will survive for maybe a couple hours, but basically without developing lungs and having no way to develop them at that point, the baby unfortunately will suffocate within a couple hours of delivery, and the chances of survival is virtually nil and incredibly sad. And for those, just to continue the story, may know that because this was discovered right around 22, 23 weeks, which was at the point of viability, which means when a baby can survive outside of the womb, and the Florida law that was recently enacted said that abortions cannot be done after 15 weeks. Now, there is an exception that says unless the life of the baby or the mother is in jeopardy. However, it says and is not viable. Now, the issue here is the definition of viability. Now, in the medical terms, viability is a time, 23 weeks, plus or minus. But the viability to, of course, a human being listening to the term is not a medical diagnosis. It's a when would you survive? When would the baby be able to survive outside the bathtub? And of course, the diagnosis would mean never. This child would never have the ability to survive. But that's not the definition that the doctors that were her OBs that were going by, her high-risk doctors who originally had advised her that she could do a termination of the pregnancy. But because she got points that age of viability and there was ambiguity in the law, the hospital decided that they would not feel comfortable going ahead with the termination procedure. Her doctors wouldn't, and it really got to be very unfortunate, and she wouldn't be able to do what she felt was in the best interest of her and her family, her 4-year-old son who was expecting to have a baby to come home, her husband who's having, of course, all of his emotions too. And so as of now, she's supposed to be going later this week, where they're going to be doing the final scans and actually checking internally to make sure that the cervix is moving along. At 37 weeks, which is where she's coming up on, they're allowed to induce, and that would really be just to induce to deliver a baby so that nature would take care of what happens next. But if the cervix isn't moving along, isn't starting to ripen yet, then there's of course a chance if they start to induce and the uterus is contracting, but there's no exit way, if you will, through the cervix, she would probably end up with a C-section. And that for sure is the last thing that she wants on top of everything else, not just the recovery of going through a C-section, but then of course there would be physical scars on her body, reminding her every day, not that she wouldn't be reminded of this every day because of how traumatic this is, but a physical reminder, the recovery that takes place after a C-section. So it's still unclear actually when the induction will be offered, but that's kind of the next play. Now, you mentioned as far as this being in the Washington Post, and this article went completely viral. And as of yesterday, it was almost 1 billion. I'm assuming it's 1 billion now. People read this article. So not only did the Washington Post post it, but and it was in their actual print newspaper, on the front page of their website as well. But other news agencies picked up and published it as well. So over 1 billion people have read about this because this story's been shared, because it's been such a impactful story on so many people. When I first went public with this, and the outpouring of love and support that this family got everywhere from, could she come to our state? We will help finance that. We will put her up. We will help with childcare. And I mean, again, this is how lovely it is to see that we have a community of people who care. I mean, that is truly phenomenal. She did make the decision because things were close enough, and of course, not knowing exactly with her concern, could there even be legal implications on her repercussions in the state of Florida because she terminated the baby outside and coming back. And of course, she didn't want to have to deal with any potential legal ramifications as well. And that's why the decision went forward. But also in the past several days, local reporters here in the Tampa area have reached out to us. We've been, the story has been very local as well, so you may have seen it there. And I want to thank all of the reporters who chose to cover this. This was a very brave thing to do, right, in order to do this. But obviously, this is a story that needed to be told. The unintended consequences. Now, I heard from a reporter today who spoke with the legislator who authored this bill, who said it's obvious that this child was not viable, and she was trying to blame the doctors for it. And I say, if that was your intention, you should have made a completely unambiguous law. Because when I hear viability as a physician, it means different than what she was describing as viability. So I say to her, again, I think she's no longer in the legislature in Florida. I'm asking her, is she going to lobby to alter the wording of this bill so that other families don't get caught up in this? This here is not a conversation about a woman's right to choose for abortion from everything else from 15 weeks. That's a different conversation to be had. But there are other types of conditions besides Potter syndrome where it could be discovered in the second half of a pregnancy that is not compatible with life. Of course, people with Down syndrome 21, trisomy 21, That's compatible with life. We know people can have wonderful lives, but there's trisomy 18, there's trisomy 13, again, not compatible with life. Even in my own family, my mother, the year prior to delivering me, actually had a baby that was had birth defects due to medication that she had taken, and immediately after the baby came out, it was obvious, that the baby wasn't going to survive. And of course, they didn't have ultrasounds 55 years ago, where they would have known this at a time of. And she says she certainly would have terminated if that was the case. But here was somebody who, if the situation was right, would she have been given that opportunity? Since we were in Florida, of course, back then she would have, if the technology is there. So this is also something that does hit close to our family because of the potential situation that could have happened, now if the situation was happening. So thank you everybody for your support. She has decided that after she delivers a baby, that the baby will be cremated and that they will be doing a proper funeral service. And so, of course, please continue to share your warm wishes and love. I am sharing with her the thoughts of it. Of course, this is very difficult for her because at the same time, this is a very private situation and a most painful situation. But at the same time, she is a warrior and says that this information needs to get out. Legislators need to know what they are doing, even as an unintended consequence. And this is patently so upsetting. That's the reason why I, of course, with her permission, have gone forward and been in the public eye about this, because if we can prevent this situation from happening for other families, that would be a great thing. I saw you. Okay, next question. I saw you on the news talking about the USDA organic food regulations. I see lots of different labels and it's confusing. Can you please provide more details? Yeah. Okay. So for those who do not know, I did a video about this a couple weeks ago. I was interviewed a couple times this past week on the news as well about this. So obviously, organic has certain definitions, and the USDA is what oversees the program, and that's when, on the food labels, you'll see the green circle with the white letters that says USDA, and you'll see different designations that probably most people don't even realize that there is actually some differences in that label and what it means. But the bigger reason why this was done in the first place was because there has been much fraud in the industry of people saying they have organic food or reporting that it's organic, but the oversight, the regulatory section, the inspectors, the instruction of the inspectors, the instruction of the farmers has been inadequate. Also, in terms of things that are coming in from overseas, not nearly, and there's just not the type of regulation at the border. So this new rule that's being put in place by the USA is supposed to account for all of that, But as far as these labels themselves go, okay, if the label says 100% organic, that is exactly what it means. 100% from seed or inception to table is all done following organic principles. Now, sometimes it doesn't say 100% organic. If it says organic USDA, that means that it is at least 95% organic, everything there, but not quite 100%. Now, you'll also see where it says made with organic ingredients. That means that between 70 to 95% of that product is done organic. And they still get the label, but it is a different designation. Now, under 70%, they're allowed to say made with organic ingredients and list, or especially listing on the back label, hey, it has organic wheat, it has organic this, but they don't get that green USDA label, which is one of the things that people look for. Now, a lot of this also, so prior to there being a USDA organic designation, in Oregon, they actually had the Organic Health, which was an organization that would certify organics at much higher standards, realistically, than what the USDA, and it was considered the gold standard. In fact, to many in the organic world, they still consider it the gold standard for organic food. And so with these new regulations from the USDA, it's getting a lot closer to that, which of course is wonderful. We want to know what we're putting into our body. If we are making a decision to eat organic, that is for a reason. If we are paying more money for the higher expense of organic food, we certainly should darn be expecting that it truly is what the label says, right? People are willing to pay for it, but what if if it turns out? Now, of course, I also educate people on the Clean 15 Dirty Dozen list of foods with their pesticides. Of course, if someone's going out or they can't eat all organic and they have to do something conventional, the Dirty Dozen list is the foods that have the absorbent, have the most pesticides residual still in the food, where the Clean 15 are the ones that have the least. So that's all, of course, not all of us can buy organic. Not all of us can source organic, right? Some things may be seasonal or maybe not local. So at least knowing if you have the Clean 15 Dirty Dozen list to consult, that you can lower the amount of pesticides that are entering into the body. Okay. I saw a new poll about how parents are too quick to give fever-reducing medicines. Can you talk about this? Yeah, so this was, I believe, out of the University of Michigan. This is a pretty hot off of the presses just in the past couple of days. Now, if you've been hanging out with me and I'm your provider, you've heard me rail for many years. If you look at our portal and our protocols for our immune support protocol, our COVID protocol, there is a common theme, which is we do not treat a number. Okay, you do not have to treat a fever, or in a lot of these cases, an elevated body temperature. So a fever by definition is 100.4 or higher, but 98.6 to 100.4 is considered elevated body temperature. And what they found is that 1 out of 3 parents were giving fever reducers, whether it's acetaminophen or ibuprofen, inappropriately. For sure, for those, and again, we're not talking about, babies who are feeling sick and lousy and need pain reduction. That's completely different. We don't want a child to be suffering. But just because a person has a fever, it is so well understood that a fever is part of the immune response. It helps us fight an infection. This is naturally generated. This increased heat, this increased energy is part of our bodies fighting off of the infection. You do not want to suppress a temperature just because it's there. In fact, I was taught back at Tampa General Hospital, mid-90s, if you let a fever stay, you get better quicker. Okay, so now, of course, if a kid is miserable, a kid can't sleep because they're tossing and turning and sweating, they're uncomfortable, their throat hurts, they can't eat, can't drink, that's treating suffering. That's treating pain. By all means, we need hydration. We need good sleep. We want our kids to feel comfortable. So if you have to give something for that, then do that. But just wanting to give one of these fever reducers, I'm comfortable with a child having a fever of 103, even to the upper parts of lower 104. Now, granted, not many kids or people at 104 are going to feel wonderful, and so we may be getting into the treating the suffering part of things. Okay, but really, and even when people say, well, what about febrile seizures? Now, first of all, of course, if a person has a history of febrile seizures, which is a fever that is not related to epilepsy, but a seizure not related to epilepsy, does not turn into chronic, but can happen with a rapid change in body temperature. Okay, a person is more likely to have a febrile seizure, and this almost happens in young children. This is almost like never in someone older. But it's more likely to jump from 98 to 102 quickly than being at 104 all day long. Again, discomfort. So that's, so again, that's where the concern is relative to the seizures. But one more thing, which one to use if you need to do something, okay? I am not a huge fan of acetaminophen, which is the active ingredient in Tylenol. Why is that? Because it goes through the liver, and one of the things that it can decrease is glutathione, which is the body's most important naturally produced antioxidant and detoxifier. Now, as part of an infection, we create oxidative stress. The white blood cell burst that happens, that the cytokines that are created that are part of the inflammatory response. Those all cause oxidative stress, which can damage cells. So if we are knocking out our glutathione by taking acetaminophen, when we are having an increased amount of oxidative stress and oxidative, and we need more antioxidants, do we really want to be suppressing that? Now, of course, not everybody can take ibuprofen. Some people may upset their stomach. There are people who are allergic to it, so I get that. I am comfortable using it in young children. In fact, ibuprofen is given to newborn babies if they have if they have a PDA, the ductus arteriosus, that happens. Then sometimes when the blood vessels in the heart is changing from being in utero over to the newborn period, and blood needs to be shunted to the lungs where it's not getting a lot of blood to the lungs when there's not air happening. So in that first breath of life, all these changes happen. Sometimes one of those pathways called the ductus arteriosus stays open. Acetaminophen is one of the things that we give to newborn babies to close it up. So of course it's safe to give a weight-appropriate dose. Now, you don't want them living on it, but that's something to do. But if a person does have to take Tylenol, acetaminophen, they can take glutathione as a supplement. We prefer one called Cetria glutathione, and as well as there's a liquid version that's called Trifortify. The reason why I like these two are these are the ones that have been best studied at the university level. Penn State did this wonderful study where they would give these products. They were measuring reduced glutathione levels, which is the active form, and oxidized, which is the inactive form, as well as oxidative stress markers inside cells when doing cheek swabs on a regular basis for these students, and they would check them before they would give it, and they would say that this is the level of their glutathione. It would go, and oxidative stress would be high, and then as soon as they give it, it would be good until they stopped taking it, went low. So this is a proven thing in studies that it can protect and boost one's glutathione, and of course, if you have to take acetaminophen, it's something to protect you there as well. Okay. Are children required to follow the CDC schedule for COVID vaccines to attend school? Okay. So while this was something that was part of the California law for a while, and first of all, this is a state thing, okay? CDC only makes recommendations, guidelines. There is nothing in terms of a mandate, a law, relative to anything that the CDC says. Okay, so yes, there were certain states like California who made it mandatory for school entry. From what I've heard, they're actually backing down on that now. Okay, but we are here in Florida. Okay, and of course, Governor DeSantis made it very clear very early on that this was something that was optional, right? So there's never been an issue with this in the state of Florida, as well as in most of the country as well. Okay, so now to be understanding about what this is, because as a society, we're moving into this living with COVID, the endemic aspect of it, where it's going to be around. And as we kind of have talked about before, it's probably going to continue to weaken, but continue to be contagious, like all of the other coronaviruses that just cause a common cold. That will become weaker and weaker and not cause the life-threatening situations, especially to those who are at risk. Right? But what they decided to do is that they are looking to do a one-a-year COVID vaccine and making that part of the schedule that is recommended by the CDC for annual. So just like they recommend that everybody over 6 months of age take an annual flu shot, and there's nothing mandatory about that, this is the type of category that it's going to be falling into. But I'm assuming just because, like, even for influenza virus, I don't believe that there's any state that mandates it for school. Okay, so I know that there's been a lot of people talking, oh, they're going to mandate that. That's what they're doing. It's none of that is true. And for sure, that's not happening here in Florida. All right. Okay, so we got a long question here, and it looks like it's actually a multi-part question. I'm going to read through this first, and then I may tackle this separately. Actually, it looks like, yeah, so it looks okay. Okay, so Dr. David, what is your medical view on this? I'm sorry, let me start it over. There it goes. Dr. David, what is your medical view on the safety of using fluoride in various dental treatments on kids and teens? I have read that fluoride is toxic, but dentists say it is needed. Also, what is your view on the yearly dental x-rays required by most dentists? Is that amount of radiation safe for kids, teens, and adults? Okay, let's first talk about fluoride. Okay, fluoride, as you know, it is an element, and it is in enamel of our teeth, and it strengthens it. Okay. Now, fluoridosis is an overdose of fluoride. And that can cause staining of the teeth, and it can even cause some brain problems. But it's all a dose-dependent thing. Okay. Now, first of all, fluoride would only be an issue if you swallow it. Okay, that's the reason why babies, until they are able to spit, nobody recommends fluoride toothpaste for them because they may swallow it. But if it's being applied, swished, spit, or in the dental office where it's applied, swished, spit, that is not getting internal to the body to cause fluoridosis in the first place. So yes, if the amount that was being applied to a person's teeth at the dentist office was instead injected into the back of their throat or injected into their veins, yeah, we got a problem. But that is not what is happening. Okay, so you have to take that into account, right? We have to remember, too much oxygen can poison us. Okay, you should never be breathing 100% oxygen for long periods of times because that itself can be a problem. I had a patient when I was in medical school who overdosed on water. She was drinking actually 6-7 gallons a day, and she completely washed out her electrolytes and ended up in the ICU because of it. It was actually a psychological condition called psychogenic polydipsia. So anything can be toxic, too much of it, okay? Now, let's talk a little bit about water with the fluoride. Okay, now, if you look at the amount of fluoride that is safe to consume, you're talking about, safe to consume, in the 60s and 70 milligrams per day. Fluoride itself, it has been determined, should never have more than 2.5 milligrams per liter of water. Okay, which means, but that's not what happens. None of the states, counties, etc., allow for more than 0.7 milligrams of fluoride per liter. Okay, so that's where you have to look at the numbers. Okay, from everything that I've seen, and I've studied this, as you can imagine, as a holistic pediatrician, this question has come up for me for 20, 25 years, and so I've always wanted to be on the top of this, and I continue to be. Now, again, in fact, the amount of fluoride, even that's done in a fluorinated vitamin, okay, like, there are baby vitamins and children's vitamins called, polyvifluor or fluoride supplementation that are swallowed. I did a calculation about this. First of all, that is never done into adulthood. It's a childhood thing. The amount that a person would have to consume orally using those types of products, it would take a cumulative, I think I came up with 60, 70 years before that would cause a problem. So there's a 50-year buffer there in terms of that level of safety. Okay. Now, of course, I understand that there are families who don't want to. And of course, in our Your Health, Your Choice, that's a family's decision. That's a patient's decision. Now, if a patient's going along and, they're getting their dental checkups and they've never had a cavity and they're not getting fluoride, obviously they're doing okay. Now, have I seen families who have chosen to avoid fluoride at all costs and their kid has like 5 or 6 cavities and things don't look very good, okay? That I would say to the parent, well, the choice that you're making is obviously not accomplishing a goal of having healthy oral hygiene. So that's somebody that I would say you might want to consider be doing more on the fluoride side. So that's really the only time where I would come up with a more stronger recommendation if there's proof that there's a problem. Or if a sibling who's been around longer is having dental cavities and now there's a younger one that hasn't developed them yet, but again, genetics, same family, what they're eating, I would say that next child would be at risk as well. So that is my overall take on fluoride. Now, x-rays. Now, the panoramic view that is typically done, now my dentist doesn't do it every year. We actually do it every couple of years. And that's kind of his protocol. So not everybody dentist does it every year. But let's talk about x-rays overall. Of course, there is radiation. Okay. Now, same question can be asked about chest x-rays too. Okay. Of course, when a person's taking a CAT scan, which is not what we're talking about, much more radiation, got to be much more careful. But my understanding is that a person who flies across the states to the other, intercoast, within the continent, is getting exposed to more radiation, being up in the sky, radiation from the sun, than they do from any x-rays. In fact, quite a few. Okay, so of course there should be a question asked to why do we need to do this every year? Well, my kid's 7 years old and he hasn't had a cavity. Everything looks good on your visual. And some doctors will totally understand that. And of course, you can't, there's not a mandate. I've never heard of a dentist actually kicking you out of the practice for refusing it. Like we know that can happen with vaccines for some pediatricians, but I've never heard of a dentist actually kicking you out of the practice for that. Okay, if you've heard of somebody, let me know. I'd be interested, but I've never heard of that. Dentists want to have people come back and want to be part of their care team. That's why I've always took the your health, your choice approach as well. So from that perspective, again, I'm not overly concerned if it's done every so often. But of course, if someone doesn't want to, they should request it. And let's face it, as with any other medical professional, if that doctor does not adhere to what your health plan and desires or your comfort level is, I'd be seeking out another doctor. Okay. Do you have any updates, updated data on the long-term safety of using CBD and CBN oil? Okay. So let me first talk about CBD. Okay. And I have not seen any research on this. Unfortunately, there's not going to be research on this. Okay. It's considered a food thing. It's not something that can be studied at the federal level. There is not a lot of money that's going to be available for researchers to see about that. But the World Health Organization does officially say that CBD, that there is no long-term problems, that it can be taken long-term. Okay. Now CBN. And for those who don't know, it's one of my favorite cannabinoids. It's actually what I get the most clinical benefit from because of how awesome it is in keeping me asleep, other patients for helping them fall asleep. But man, what a difference it is for me to be able to stay asleep all night long, sleep until my alarm clock, on weekends even to be able to sleep a couple hours later, which I hadn't done that since like college days. CBN is its own cannabinoid. It can be isolated from hemp. It can be isolated and from more traditional marijuana. It's actually the chemical that THC becomes once it's no longer has the effect that people would typically seek THC for. So it's not intoxicating. Okay. Now, of course, this has been part of the plant forever. But it's been relatively recent that people have isolated it, concentrated it, and given it as its own treatment. The product that I take has 40 milligrams in one dropper full. Okay, that's not the way it naturally comes. It's been isolated and purified and put into that product. So we do not know about long-term safety for this. Certainly, if somebody said, "What is my medical intuition tells me?" Do I think that the long term of taking high doses of melatonin, which is supernatural, if you told me I can take 1 milligram of melatonin, that's fine. That's probably fine. Certainly, a lot of the pharmaceuticals that are used, we do not want people taking long-term benzodiazepines, although it can help people sleep, right? You can become addicted to that. We know that. You can build a tolerance to that. We know that. I've been taking the same dose of CBN for well over 2 years now without needing to increase it, okay? But we do know because it hasn't been around long enough and it hasn't been studied. So it's considered like a generally regarded as safe type of thing. With everything, of course, we need to weigh the pro versus con versus the alternative. So, of course, if there's no other alternatives and somebody can't sleep without it, the importance of sleep is too much. We know the restorative aspects for our brain, for our mental health, for our physical health, everything. Cardiovascular health requires good sleep. So you have to always be weighing that question. What's the pro versus the con versus the alternative? And for you, it may be different, but of course, when I'm talking to families about sleep, I'm not just jumping to any of this. I want to know so much about what's going on with that patient. When is the patient laying down versus falling asleep versus waking up? What is happening in the hour or two prior to bedtime? Is there a routine going on? The brushing of the teeth, the taking of the bath or shower, the reading a bedtime story, listening to calm music, as opposed to, is there any screen time? We know that both the light from the screen itself, but even most times when, they're kind of exciting, if you're playing a game, if you're chatting with your friends, there's excitement. It's not the type of bacteria. Did I say bacteria? Not the type of activity that lends to calming oneself to move into that sleep night phase. How dark is the room, right? Should be very dark. How, in the morning, how much exposure is there to direct sunlight right away? One of the best ways of setting our melatonin cycles is making sure it's super dark when you're sleeping. As soon as you wake up, expose your eyes to direct sunlight, even getting outside. That sends a signal to your brain, wake up cortisol, get it up there. That's so melatonin and cortisol, as you may know, does this thing. Melatonin goes high and cortisol goes low at night. Then the opposite is supposed to happen. It's a circadian rhythm that goes back and forth. And we need to be able to do that in order to have proper sleep hygiene, right? I teach people about calming relaxation, belly breathing, meditative mindfulness types of breathing. That it's something that if I ever wake up and I do need to fall back to sleep, I'm not right back. I'll just start. People talk about counting sheep. I do more like belly breathing with a rhythmic count things in for the breath, holding it and then letting it out. All those types of things as well. So all of those things should be done before you should be talking about any kind of treatment, whether it's natural or whether it's pharmaceutical. So that's part of a proper sleep hygiene. Okay. I use a weighted blanket. I sleep a lot better. I used to sleep with just a top sheet. I find when I sleep, a weighted blanket, which could be like a 15, 20 pound blanket, and it's like you are being hugged by the entire thing. It's just like this beautiful, for people who have sensory issues, that kind of like hugging, that warm feeling. That's something that can be very helpful as well. That's something that I do suggest as well. Okay. Now, there was a kind of a second part regarding this. So let me take a look at it. What is your medical view on using passion flower long-term for helping with sleep issues in teens and adults if other natural supplements do not work as well? Now, that is a very important last part of the statement, okay? Because in my opinion, you got to do something to get sleep. Now, hopefully you would have addressed all of those other things that I had talked about regarding the sleep hygiene. But at the same time, passion flower has never really been looked at for long-term periods. It's considered safe for a week or two. There have been studies that have looked at 8 weeks, but nobody has looked at it for 8 months or 8 years. So obviously, we just do not know the answer to that. Now, again, we can ask ourselves the same questions. How would that compare to an Ambien? How would that compare to taking a Valium or a Xanax, right? All of a trazodone, all of those other types of things that people use for sleep. So there's back to that, what's the potential risk versus benefit compared to the alternative? By all means, if passion flower is the only thing that keeps a person asleep and they're dreaming well, which means they're getting into that REM sleep, that restorative part of sleep, that they are feeling good wakefulness and good energy, not dragging during the day, not feeling hungover from it. Well, you put that all together, and that would lead me to, if there's no other alternatives, it's something you do. All right, I hope that helps. I know that was kind of a lot relative to this one question, but of course, I love these types of in-depth questions, and please keep them coming. Okay, well, that is all. Okay, well, thank everybody for submitting questions. This is definitely one of the highlights of my month, doing this and just kind of being put on the spot, as I said. So, we like to see questions come in. Sometimes I may want to look something up earlier that day just to kind of see things. But of course, when questions come in without any prep also, that's sometimes fun. That's really fun because, let's face it, that is what I'm doing in my consultations on a day-to-day basis. People aren't necessarily asking me every one of their questions. Things will come up in a consultation, and I'm on the spot. So I'm glad I have the opportunity to share it in a bigger forum. So again, if you haven't subscribed, please do so. Please share. Please join us on Patreon. You can access all the other information that we're keeping for our members there. And have a great day.